My name is Cecil Dorman. I had both knees replaced at Emerson Hospital.
Dean Howard, I'm an orthopedic surgeon on the staff at Emerson Hospital. I do elective and emergency surgery, cover the emergency room, take care of patients on the floors, and I've been doing this for about 25 years.
I have gone through a lot, I feel, in that my arthritis, which is what caused me to seek out the knee replacement, it's really been a problem for my whole family. But in my case, it wasn't really an injury. It was really more of a chronic arthritis that led me to seek out knee replacement surgery.
A typical candidate for knee replacement would be a middle-aged to older-age patient with knee arthritis. This would be a knee replacement. So you have on the bottom a piece of metal which bonds to the tibia. On the top of it, a piece of polyethylene plastic. And then on top of that now, the femoral component. This would then move on the plastic as the knee was bent.
You know, I did consider going to other hospitals, but in a sense, I really wanted to stick with what my physicians, my surgeon, what they were recommending. And since Dr. Howard practices at Emerson, and since I had come to really trust him, I thought, well, let's try Emerson. You know, when I think back on how long I was in the hospital, I think it was pretty efficient. I had the surgery on a Friday. I was in the acute care. Obviously, I couldn't walk when I had just left the surgery. So there's 3 days in there where they actually come, and the day after the surgery, they get you to stand up, which is pretty scary the first time you stand up. The next day, the physical therapist comes in, and they get you to do a little bit more. You stand up with a walker, for example, and you walk to the door and back. I mean, it's 10 feet, but it seems like you've walked a long way. That lasted about 3 days, and then they moved me into the transitional care unit, which in this case is they move you upstairs. Right away, you have the similar kind of nursing, but you can see that there's a transition to it. You can see that they've got a schedule on the whiteboard in your room, and now they're moving you into the activities that you would normally have. They teach you how to take a shower. They teach you how to walk with a crutch. There's a lot more to that than I ever realized. And at that point also, you've met with Dr. Howard again. So there's a post-operative visit of like a month after the surgery, and he makes sure that you understand the rehab has to continue. You've got to continue bending the knee, straightening the knee, doing all the exercises that you did in the transitional care unit. What happened after that was that there's a home care where a nurse comes to you and takes your blood, does a blood test several times a week, and a physical therapist comes directly to your home and makes sure that you're doing the same exercises they taught you to do when you were an inpatient. But I had the same nurses coming, I had the same physical therapists coming. With Emerson, I had the same people, they knew each other. It was really great. I think Emerson does it right, so I do recommend to people to consider Emerson. I'd say after 2 months, I was pretty much back to normal. I'm told that after a year, you forget that you ever had the surgery. I'm looking forward to that.